Welcome, everybody, to our Chicagoan focus for October. Environmental justice is reproductive justice. I know I'm personally really excited about this talk and to have our speaker here. And just a few words before we get started. Hello to everyone in our audience and also everyone on Zoom. We really appreciate you joining us on this really, summery evening. Also, exciting stuff politically happening in the state. So I appreciate everyone joining us. And here we go. So my name is Jane Ruby, and I am president of the League of Women Voters of Chicago. The League of Women Voters of Chicago is a nonpartisan grassroots organization working to protect and expand voting rights and ensure everyone is represented in our democracy. We empower voters and defend democracy through advocacy and education. Formed from the movement that secured the right to vote for women, the centerpiece of the League's efforts remain to expand political participation and give a voice to all Americans. LWV Chicago continues to pursue its goals through a range of voter service activities, including voter registration drives, disseminating information for voters, participating in poll watching and hosting candidate debates and forums, through education of its members and the public, to lobbying the government on selected issues, and through the observation of the functioning of governmental bodies and monitoring their accountability and transparency. In the past few years, LWV Chicago has worked on some inspiring projects, including the passing of legislation turning Cook County Jail into a polling site. Our democracy remains a work in progress. Even if it takes another century, the League will see it through. And with that, I'm happy to bring up our Committee on Diversity and Inclusion Chair, Dr. Whitetrice Richardson.
Hi, everybody. So I'm Whitetrice Richardson, and I am the director of the CODI committee, the Committee on Diversity, Equity, and Inclusion. And our committee supports actions that enhance diversity, equity, and inclusion in our work, in our membership, and in all of our programs. So if you are interested in being on our committee, we're always looking for people. I am here, though, to introduce tonight somebody who I read the bio and I'm like, oh, she's fabulous and fancy. So I am going to read a little bit about Chakena D. Perry. She is a voting rights champion and a clean water and environmental policy advocate. She currently serves as senior policy advocate for the Safe Water Initiative at the National Resource Defense Council, where she's responsible for assisting in the development of cross-programmatic strategies, partnerships, and advocacy efforts to ensure water is safe, sufficient, and affordable from source to tap. In January 2022, Illinois Governor J.B. Pritzker appointed Perry to the Metropolitan Water Reclamation District Board of Commissioners to fill a vacancy once held by former MWRD Commissioner Deb Shore. She was the youngest MWRD commissioner and the youngest countrywide elected official in Cook County, the second most populous county in the U.S. Chakena earned her bachelor's degree in history at Connecticut College as a posse. Now, this is a lot, so y'all hang on. Listen to this. As a posse full tuition leadership scholar recipient and Holleran Center for Community Action scholar. That's fancy. She served as the young alumni, she served as the young alumni trustee on Connecticut College's Board of Trustees from 2016 to 2019. And in 2022, she earned her master's degree in public policy at the University of Chicago. And y'all know the University of Chicago is fancy. And she currently serves as a Harris School alumni admissions ambassador. She is a board member of Planned Parenthood Illinois Action and co-chairs the newly developed Black Maternal Health Task Force. In her free time, she enjoys studying, videography and filmmaking, playing basketball, bowling, and exploring coffee shops throughout the city of Chicago. She is the proud wife of Christian Perry, and she resides in Oak Forest with her son and their dog. So let's welcome Chakena D. Perry with her fancy self to talk about a real important issue.
Hey, good evening, everyone. Let's bring this down a little. As mentioned, I'm Chakena Perry. Super excited to be here. It's weird, headlining the event. So hopefully I have something interesting to share tonight that everyone can leave here today learning more, inspired to do more for our communities, anything in between. So this conversation is really important to me because I call myself the water queen. People laugh at me when I call myself that because I love water policy so much. So I've worked in stormwater, wastewater management. Now I'm working in the drinking water space. So I'm just kind of learning all of the different aspects of water. And people joke because they say this is such like a niche little area. There's like a lot of water nerds talking about infrastructure all day. But it actually, water is important to our everyday lives. Access to water is something that we take for granted, particularly being so close to Lake Michigan, one of our Great Lakes. And then folks across the country, even here in Illinois, don't have access to clean, safe, and affordable drinking water. So I always think about the ways that water intersects with other social impact areas. And one of those areas is Black maternal health, which is the point of today's talk. Also, Jane, it made me laugh because my headshot that was floating around, I look totally different because I have a new hair color now. So now I need to like expedite getting these new headshots done. So thank you, Jane, for reminding me of that. So let's get started. If you know anything about the South and West Side of Chicago, there's this debate between the two. Which side is better? There's some deep pride on each side of the city. I'm from the South Side, born and raised, but people don't know that I was actually born at St. Anthony Hospital in North Lawndale and on the West Side. I'm sharing this. I see someone else is born at St. Anthony in the audience, so shout out to St. Anthony. I'm not sharing this to revoke my South Side card because I know we're on the South Side right now, but it's relevant for today's conversation. My mom, since I was a kid, always recounts her experience giving birth to me. I'm the only child. And it just really shaped my understanding of how women interact with our reproductive healthcare system. So let's take a trip back in time. It's October 1993. My mom was giving birth to this wonderful baby girl named Chakena. You may or may not know her. That might be me, who knows? My mom told me that she didn't receive an epidural while in labor. So for folks who don't know what that is, it's a procedure that injects local anesthetics into your lower back, kind of numbs you, blocks pain from when you're having contractions, and you're still able to push the baby out. Sounds okay to me. I know it's could be problematic, but that's not for this conversation. So an article published by UChicago Medicine years ago stated that a third of women who go to Catholic hospitals, which St. Anthony Hospital is Catholic, aren't aware that they're seeking care at a facility that has limited care options due to religious affiliation. So I asked my mom, not knowing that she went to a Catholic hospital, didn't know that these options were limited, when you asked about the epidural when you were going in labor and they told you couldn't have one, what did you do? She said she started screaming. I was like, I don't blame her. So this was 30 years ago. And I read a few different articles recently about how there's been a push for greater hospital transparency so women know ahead of time what their options are so they're not caught off guard. But the part that makes me laugh and cringe at the same time is that my mom said she was screaming, but the nurse kindly told her to be quiet because she was disturbing other patients. So fast forward through all of that shock and pain, I'm here today. Thanks, mommy. Now, I think about Serena Williams' story. So Black maternal health is nothing new. Black women have been dealing with issues with their health, reproductive health for a very long time. But just as within like the last 5 to 8 years, there have been really prominent women, particularly people like Serena Williams, that really said, I want to talk about this more publicly. One of the greatest players of all time in tennis. She has some of the best access to medical care in the world, but still had trouble in the hospital room. So here's an excerpt of what she wrote for Elle magazine about her birthing struggles. So much of what happened after that is still a blur. I may have passed out a few times. In my haze, I wondered if I should ask someone about my drip. In 2010, I learned I had blood clots in my lungs, clots that, had they not been caught in time, could have killed me. Ever since then, I've lived in fear of them returning. It wasn't a one-off. I'm at high risk for blood clots. I asked the nurse, when do I start my heparin drip? Shouldn't I be on that now? The response was, well, we don't really know if that's what you need to be on right now. No one was really listening to what I was saying. The logic for not starting the blood thinners was that it could cause my C-section wounds to bleed, which is true. I still felt it was important and kept pressing. All the while I was in excruciating pain. I couldn't move at all, not my legs, not my back, nothing. I began to cough. The nurses warned me that coughing might burst my stitches, but I couldn't help it. The coughs became racking, full body ordeals. Every time I coughed, sharp pain shot through my wound. They were trying to talk to me, and all I could think was, I'm dying. I'm dying. Oh my God, I'm dying. I couldn't breathe. I was coughing because I just couldn't get out enough air. I grabbed a towel, rolled it up, put it over my incision. Sure enough, I was hacking so hard that my stitches burst. I went into my first surgery after that C-section to get restitched. In the other room, I spoke to the nurse. I told her I need to have a CAT scan of my lungs bilaterally, and then I need to be on my drip. She said, I think all this medicine is making you talk crazy. I said, no, I'm telling you what I need. I need the scan immediately, and I need it to be done with dye. I guess I said the name of dye wrong, and she told me I just needed to rest. But I persisted. I'm telling you, this is what I need. Finally, the nurse called my doctor and she listened to me and insisted that we check. I fought hard and I ended up getting the CAT scan. I'm so grateful to her. Lo and behold, I had a blood clot in my lungs and they needed to insert a filter into my veins to break up the clot before it reached my heart. That's story number one. Story number two. Now, some Black families, including Latinx families, believe that ginger ale and Vicks Vapor Rub cures all ailments. You have a cough, Vicks it is. Fever, ginger ale will do it. But when Vicks and ginger ale alone won't tackle the problem at hand, we're forced to seek out medical care if it's available to us. That's a shameless plug for universal health care. My mom, like many people, has utilized the healthcare system, and despite telling multiple doctors about how she's feeling and how things just don't seem normal with her, her flags were often downplayed, with her being prescribed over-the-counter medicine, being told it's all in her head, which sheds light on this issue of medical bias regarding Black people's relationship with pain. According to a Pew Research Center survey focused on Black Americans' views on health disparities, among the respondents, it was reported that when it comes to treatments for pain, 35% of Black adults say that the pain they were experiencing was not taken seriously, recently or in past interactions with doctors and other healthcare providers. 35% of respondents. And this is troubling because we hold our doctors in high regard. When we seek out care, we're expected to be heard and treated with dignity. And I asked my mom today, literally today, if she ever had a Black primary care physician, and she said no. Why does this matter? Why does it matter if Black people have access to Black doctors? According to the Association of American Medical Colleges, out of around 841,000 active physicians, this is from 2021, only 5.7% identify as Black or African American. And even if you narrow that down to OB-GYNs, there's around 39,000 active physicians, 10.7% of whom identify as Black or African American. Just like anything, representation matters. but studies have shown that Black patients have improved health outcomes and are more likely to agree to preventative care options when they have a Black physician. This is not to say that doctors can help, that only Black doctors can only help Black patients achieve these goals. But as Dr. Jenna Benunis from Georgetown University stated, if you have a provider who looks like you, you're typically going to get better care because there's going to be less implicit bias and hopefully someone who understands what you've been going through. All right, so that's the first part. That's Black maternal health. So you heard a little bit about my mom's experience, how it's kind of shaped my understanding of how the healthcare system works. Now we're going to walk into the more environmental side of things. Who here has heard of Hazel M. Johnson? Is anyone here? Beautiful. No one? Well, good and bad, because I want you to know about Hazel M. Johnson, but this makes it even better because now you can walk away with something new. So Hazel M. Johnson is from Chicago. She's the mother of the environmental justice movement. She lived in the Oakdale Gardens neighborhood on the southeast side of Chicago. And yes, there we go. And her daughter, Cheryl Johnson, is still doing excellent work through the People for Community Recovery. I personally wish I would have known the term environmental injustice growing up because it would have helped me make sense of the environmental degradation and governmental neglect of the community I grew up in, the Back of the Yards. For those who don't know, the Back of the Yards has a long history of environmental fights. It was a home of Union stockyards where parts of the area became large garbage dump sites, or where the nearby waterway in the South Branch of the Chicago River, notoriously known as Bubbly Creek, became the dumping site for raw sewage, chemicals, animal carcasses, and other hazardous material that literally caused the river to bubble. I also lived in Ashburn on the city's southwest side, which historically was a dumping ground for ashes, literal ashes. And today, it's the site with a lot of rail car traffic, factories, and other industries causing air pollution. My husband and I have lived in different areas of the South suburbs now for the past 5 years, and similar to some Chicago neighborhoods, there are municipalities in the Southland that are prone to flooding. Most of Cook County was built on swampland, and following the Industrial Revolution, many of our communities were built with impervious pavements, such as concrete, that don't soak up rainwater. Prior to the historic investments from the Biden administration's bipartisan infrastructure law, water infrastructure has nationally been underfunded and underinvested. And with climate change causing heavier rainstorms and more frequent rainstorms, our sewer and stormwater systems are often over capacity and can't handle the volume of water entering the waterway. Even worse, the Chicago Tribune developed a study a few years ago showing how the south and west sides of Chicago have fewer trees than the north side of Chicago. Trees are important for not only regulating temperature and air quality, but they help capture rainwater. I don't know how many of you in here experience flooding, but it's something that's dominating the news cycles right now, and people need answers. Flooding is a quality of life issue that not only causes inconveniences to travel. Think about the amount of buses and cars that have to reroute due to stagnant water. Think about members of our disability community, folks navigating an injury who have limited mobility, or our elders that already face barriers from broken sidewalks or not having a sidewalk at all, and now having to figure out how to navigate all of this water in front of their home. Think about the out-of-pocket expenses to fix basement damages or having to throw away all of your precious childhood photos and memorabilia because all of the boxes in your basement are wet and damaged. Think about insurance claims that residents have to file for flood-related damages. If you want some extra homework, check out the study by the Center for Neighborhood Technology called the Flood Equity Report. It talks about how 87% of the flood damages claims in Chicago were from communities of color. It also talks about how flood insurance only covers a couple $1,000s, but people are paying double, triple the amount out of pocket due to the frequency of rainstorms. But the part we don't talk about enough is how the presence of stagnant water has serious health complications. Think about the mold that develops on walls and the bacteria that sewage contains and is hanging out in our homes. Breathing in mold can make you sick. The CDC says that people with breathing problems like asthma or who have weakened immune systems should stay away from moldy sites and should not participate in flood cleanup. Children and pregnant people should not take part in flood cleanup work. But what if you're a single parent? What if you're elderly? What if you don't have a family that can help? These are risks that people take every time a rainstorm happens, and they shouldn't have to choose between cleaning up and their livelihood. And if that's not enough, we have this other huge problem lingering over our heads, which is lead pipes. Chicago has more lead pipes than any other US city, more than 400,000. Up until 1986, workers were allowed to install lead pipes in homes. There is no safe level of lead exposure, yet people have water flowing into their households that's potentially contaminated. And individuals in low-income communities and communities of color are more likely to live in areas that have lead pipes. Access to clean water is critical. People need water to drink, to bathe, to wash their hands, to cook, to survive, and to ultimately prosper, but it's not promised for everyone. After outlining all of this, it sounds like the world is on fire. And honestly, it is. But in order to put out the fire, we often think about these things intersectionally. How do some things affect other things? How can we connect the dots and ensure that people who need us the most aren't left out? How does this relate to Black maternal health? So here are some random things to note about Black maternal health and clean water access. Black women are more likely to live in areas disproportionately impacted by water pollution and air pollution. Black families are twice as likely to live in communities serviced by lead pipes. A 2020 study found that prenatal lead exposure increases the risk of low birth weight, and even low-level exposure can cause permanent damage to a developing fetus's nervous system and later behavioral and learning disabilities. For women, lead exposure before and during pregnancy can cause fertility problems, premature birth, and miscarriage. And lead isn't the only problem. Black communities are often disproportionately exposed to PFAS in their drinking water. The chemicals have been linked to decreased fertility, as well as life-threatening conditions and pregnancy-induced hypertension. What prompted me to write the Harvard Public Health op-ed that really connects reproductive health and access to clean water was reading about Tori Bowie. So I read about Serena Williams, I read about other women, but something about Tori Bowie's story really struck home with me. She's a 3-time Olympian, she was a track runner, and she passed away at the age of 32. Just last week, I turned 30. And so as someone who, I'm a bonus mom right now, my bonus son is awesome, but if I were to have a child one day, just thinking about all of the things that I just named about being a Black woman and being disproportionately affected by all of these different environmental harms, a healthcare system that's lacking, the medical bias that's included in all these things, it doesn't really make pregnancy something to really look forward to. But hearing Tori Bowie's story really made me think about what can I do in this research capacity to educate other people, so make this conversation a little bit more widespread. So I thank the League of Women Voters for tapping me to have this conversation, because it's something that we don't talk about enough. I read from the medical examiner's autopsy report that when she passed while undergoing labor, and possible complication was from respiratory distress and other like high blood pressure related symptoms. Both of the two conditions were well documented, and although their precise causes aren't yet known, this is something that a lot of Black women deal with that we still haven't figured out how to handle. So that's a lot tossed at you. We're looking at the Black maternal health side of things. We're looking at access to clean water, but there are some things that folks can do in the interim to kind of really educate yourself a little bit more, get involved a little bit more intently. So one, in my bio, you heard that I'm a co-chair for Planned Parenthood Illinois Action's newly developed Black Maternal Health Task Force. So a friend of mine, LaToya Dixon, and I, we've been on the Planned Parenthood Illinois Action Board for a while now, and we just want to see more intentional conversations around Black maternal health. We talk about a lot of things. Planned Parenthood is not just about abortion access, it's about reproductive health in general. And so we're just really trying to push our network to think more intersectionally about these things. What legislation is out there that we can support? What community outreach activities can we do? What fundraising mechanisms can we do specifically about Black maternal health? So that's something we're working on right now, so stay tuned. If you were to get involved with Planned Parenthood Illinois Action, there are a lot of engagement activities and opportunities, such as like the Black Organizing Program, the Disability Advocacy and Organizing. There's a Latinx Community Engagement Program, as well as a Young Adults Program. So all of these things can be found on PlannedParenthoodIllinoisAction.org. And like I said, the Black Maternal Health Task Force is making sure these conversations are at the center. Most recently, the Congressional Black Maternal Health Caucus, they have a Momnibus is what they call it, which includes 13 individual bills to improve health outcomes. Our very own Congresswoman Lauren Underwood co-chairs the caucus. So if this is something of interest, contact Congresswoman Lauren Underwood's office directly to figure out how to get involved, to follow what the bills are doing, where they are, how people can be supportive. As you know, I work for NRDC, and if you go to nrdc.org, there are 2 links that are on the main homepage. There's one is how to find out if your home has a lead service line. So as I mentioned, there are over 400,000 lead service lines in Chicago. The likelihood of you having one is high. So if you go on there and put in your address, it takes you through like a really short process and lets you know if you have one. The city of Chicago also has different programs in place. There are like 11 or 12 different programs to help people get their lead service line replaced. I won't go down the rabbit hole of how effective those programs are right now, but there is an equity service line program that's in place. And if that's something that you think is of interest to you, if you meet the income thresholds, it's worth pursuing. In addition, there is another article on nrdc.org. If you scroll to the bottom a little bit, it's one of my colleagues named Gina Ramirez. You will read about how it took 43 years for her mom's lead service line to be replaced from their home. She actually went through the Equity Line program through the city of Chicago, and it took multiple years to even get through the process. But I think last month, her mom got her lead service line replaced, which is awesome. But if you go onto that article, you will see a call to action. And if you were to press that link, you can send a message to the federal government about how important it is to get our lead pipes out quickly and efficiently and equitably. In addition, 2 more quick things. There is a federal push right now. It's called the Lead and Copper Rule. The Lead and Copper Rule revision is something that the Biden and Harris administration right now is pushing for a 10-year timeline to replace lead service lines across the country. Right now, Chicago is on a 50-year timeline to replace its lead service lines, which is asinine. So as we wait for the revision of the Lead and Copper Rule, which should either roll out this month or next month, it will tell municipalities across the country what the timeline is that they need to get their lead service lines out. Biden-Harris administration is pushing for a 10-year timeline. We will see if the 10-year timeline holds. It's the Environmental Protection Agency gets to dictate what that is, but that's something to be on the lookout for. Because there will be public comment drives, particularly one that NRDC is going to be pushing, trying to get 1 million comments from everyday residents, everyday citizens, folks who are accessing drinking water, so that's anyone, to sign up and let your voice be heard that you want to get these lead pipes out quickly. And last but not least, if you live in Chicago, contacting your local alderperson and saying that we need filters, right? So in the meantime, like, we have lead pipes. They're not going anywhere yet. The city is trying to do what they can right now to get the lead pipes out. They need to speed it up. But in the meantime, folks should have access to safe, clean, accessible drinking water. And if they were to provide filters via pitchers, along with the replacement filters, that's something we can do in the interim until they start getting the lead pipes out a little bit more quickly. So I'm going to stop there for now. I'm going to take some questions from folks if there are some, but I want to preface this by saying that it can be questions about what I've already shared. It can be questions about something I haven't shared. Whatever it is that you want me to expand upon, I'm happy to answer.
So we have a question from online. What do you think about the recent large-scale development projects on the west side? What would you want to see from them to help close equity gaps related to, a lot of what you're talking about with water and just kind of, basic infrastructure? An example of this would be like in what's going on with Woodlawn, with community-led development committed to advancing health equity. What can we as residents and Chicagoans do to help push the private capital coming into the community to really improve the community for its existing residents? So I know that's a lot, but I think just sort of there's a lot happening in terms of development and ways that we can kind of incorporate a lot of this environmental justice stuff into that work, I guess.
Yeah, that's a really good question. So there's a lot of development, so I'm not particularly sure if there's a specific project that you're all referring to. But there are two things that are happening. The Mayor Brandon Johnson administration just released a cumulative impacts assessment that really gets into the weeds of what's going on in our communities, what communities are overburdened, how much industry are we building in certain communities, in the industry, meaning factories and other type of like pollutant driven factories and stuff that we put here, like versus other communities. So they released a cumulative impacts assessment. Is worth reading. A lot of the stuff won't be news to folks who live in the communities, but it is something, a baseline to really see about when we think about new investment, when we think about new development, let's be creative with the type of things that we bring. So often, what communities have been deprived and starved for so long, people hear things like the Amazon warehouse or they hear about a factory. These things look appealing because unemployment rates are high. Folks don't have access to diverse jobs. People are trying to pay their bills and put food on the table. So a lot of times these type of developments sound great because of the immediate impact that people get from them. But when we think about the long-term health impacts that building another factory or building another rail car system in certain communities is going to have on our health, it's a trade-off. And so that's one part to look at. The Johnson administration is also incorporated in his budget the Department of Environment. And so this will be another vehicle to really work hand in hand with our developers, work hand in hand with any folks that are bringing any type of new infrastructure project, any type of development, any other investments, to really make sure we have a holistic, like robust criteria in place about if you are have any type of pollution, do you have pollution control in place? Making sure that these folks aren't dumping into our waterways. And so there are some like ordinances in place right now that really regulate that, particularly through the water reclamation district, but really like putting a tighter hold on that. If you do violate these things, what are the consequences for it? Is it a fine? Are we forcing you to shut down? Are you going to be on probation? So there's just like a lot of criteria, I think, between the cumulative impacts assessments as well as the Department of Environment to really put something in writing in place and just make it very clear that if you're coming into our communities, you need to work with the communities. So talking to the residents, talking to community groups, actually hearing from what they need from this new development is not just about coming to build something here and everyone's going to like celebrate. It's like, we want you to be a long-term partner with us and not just doing things on your own because you think you can. Like everything should go through a community-driven process. So I think those are three ways, speaking broadly about different type of developments that we're bringing to Chicago. And hopefully they have a long-term plan about, if they do, the way Chicago looks today is not the way it's going to look 10 years from now. So being flexible in their approaches when they're drafting whatever these plans are that they're doing that needs to be adjusted if the community thinks it needs to be adjusted. So hopefully that answers the online question.
Hi.
Hi.
This is fascinating talk, and thank you so much.
Thank you.
One thing that really struck me at one point, you said that different religious-based hospitals may not provide the types of services that you might get at other hospitals.
Mhm.
And I just found that really surprising. They have patients in front of them, and that should be the number one piece.
Mhm.
And it's not asking for, when you're delivering a baby, doesn't have anything regarding, abortion or anything. So can you talk a little bit more about what that means? And is there a way for people, when they are going to give birth, to know that there are certain hospitals that might not provide some of the services that they would need? And since I had an epidural, I can't imagine not having one. So there you go.
No, I think that's a fascinating question. And so I should have started this talk, like, I don't purport to be an expert of all things, right? I do have a privilege to be able to work in the water space, and kind of, look at all of these things intersectionally. I actually just found that, like, my mom has told me this for years, right? But it was just early this week that I was like, what is the premise of this? Like, where is this coming from? And so I just saw a bunch of articles about it, just saying like how over the years the hospital is just transparency. So I think in '93, when I was born, it was at the time like, if you go to the hospital, you go in there, you weren't really read any type of, reading rights is the wrong way to put it. But you weren't really like briefed on what expectations you're going to have here. It's just kind of like, let's get you ready to start giving birth, and we're just going to go with it. I think now there's a different approach to it. I read an article that there's and I can find it, but there's some sort of like, not a think tank, but there's something online, like a database of some sort, that when women are, looking at where they're planning to have their child, whether it's through midwifery, whether it's actually going to a hospital, it actually supposed to list all of the different type of procedures and medicines and other things that are offered there, so folks aren't caught off guard. So that's another question of, we know that access to broadband isn't universal here in America, so everyone doesn't have access to internet to just go research. Everyone doesn't have time to just, sit down and look up this stuff. And there's a lot of misinformation out, and people just don't even know this exists. I just found out this exists early this week, and I've been studying this stuff for a long time. So I think although there is a good push to be more transparent, I think there hasn't been a good way to really socialize this, that people know it exists and they know that there's a database online. You can go look it up. Because right now, I just think it's even overwhelming, just the idea of going onto a hospital's website and trying to read and see what I have access to as someone that's pregnant. I think that's overwhelming. So to answer your question, I don't really know what this is going to look like in the future, and like what type of things they can do to improve. But I do know that it's one thing to have something living online, and one thing to have people not know it exists. So how do we fix that?
This is a question out of ignorance as much as it is out of frustration. We talk about the city, we talk about the state, we talk about federal. Are they working together, or are they just waiting for the other one to do something? What's really happening as far as what you can see? And I think if you could finish that question with what are some things that we can do right now to help Representative Underwood? That's a great start. I liked that.
Mm-hmm.
Thank you.
Oh gosh, is it working? I think that government can always do better with talking to one another. I think when it comes to, in Illinois, I think we're an oasis in a lot of ways, because I do think that we have representatives that want to be, intentional about partnerships, intentional about community engagement, being like coalition building. But that's not the same across the country, depending on, whether it's red or blue or what the interest is, right? And And so I think from a Black maternal health perspective, I do see some synergy. So Cook County Commissioner Donna Miller, so she represents the Southland. She worked with Congresswoman Robin Kelly, then also worked with State Rep Mary Flowers to host like a Black maternal health. It was like, I wouldn't call it a summit, but there was like a convening of some sort, either earlier this year or last year, to really talk about these issues and like what ways that local government can work hand in hand with the federal government to push these things along. Congresswoman Underwood, the Momnibus bill that they put together, so the 13 different individual bills are listed, was a culmination of different work that community-based organizations, doctors and physicians like OB-GYNs, as well as other like philanthropic organizations that fund these different type of Black maternal health programs. They all work together to kind of identify, like similar to like Planned Parenthood, Illinois, is like we're a direct provider to folks who need our help. And so these bills were designed with them in mind. So they were at the table saying like, this is the type of healthcare that I need. These are where the gaps are. These are the type of things that I think will improve my quality of life or my relationship with my physician or my experience of even visiting the doctor in the first place. So I think that's the cool part about that Momnibus bill, because all 13 of those were like community driven in some sort of way. So I think that's a very good example of like how in Illinois, from a Black maternal health perspective, they're kind of working hand in hand. But from a like a water policy perspective, it gets a little tricky, right? So City of Chicago, we had Mayor Lori Lightfoot previously, and she, to her credit, was the one who really started talking about lead service line replacement in like a really intentional way. Prior mayors didn't touch it with a 10-foot pole, but although she brought it up, the efforts to actually replace the lead pipes were like glacially slow. The programs, like I think there was this ambitious goal in place that she put. They only replaced like 200 or 300 by the end of the term, which is like nothing when I said 400,000 lead pipes. So now with a new administration in place, it's going to be important for, Mayor Johnson at the city level to advocate to the state to say, hey, Chicago has a massive amount of lead service lines. We need more money from the Illinois Environmental Protection Agency, but that funding needs to come from the federal level, right? So I think the Black maternal health angle is a little bit clearer because it's like, these are the things that we need now. And then, we need to find the funding for it. For the lead pipe replacement in Illinois, it's going to be a little bit tricky because the first round of funding has already been provided from the federal government, and then people need more. So now we need to be creative in the ways of like, how do we fund lead service line replacement that isn't solely dependent on the federal government? And so that's what's going to require the city and the state to really work hand in hand to be like, all right, let's put the egos aside. Let's have the political will to like, let's get this done quickly and not on this 50-year timeline. That makes no sense. It's 50 years like plus extensions. So if this starts in 2027, so the work is supposed to start in 2027. On the 50-year timeline, that'll put 2077 when this will be done, but they can also apply for extensions if they wanted to, which could push this to 2092. So it makes no sense. So that's a long way of saying like, and one angle is very clear, the other angle is not very clear. And yeah.
Thank you. This has been really interesting. Back when I had a job, when I had children, there was much more availability in terms of hospitals and the like. Right now on the South Side, I think if you're pregnant, there's Northwestern on the north end, Chicago, University of Chicago, but primarily Christ on the south end for people all in between. Is anything being done to increase the number of hospitals? And also, when one of my grandchildren was in elementary school, they tested the children for lead poisoning. Mm-hmm. And they had to redo their whole house where they lived because of the lead in the paint. in the building. Is anything like that being done in the schools now that you're aware of?
Yes, so there is, so there's a ton of stuff now, like particularly when we're talking about like just lead service line replacement. You know, it's a different type of situation with the lead in schools because it's using different fixtures, but it's still lead in water regardless. There actually trying to be some push legislatively about how to, you know, remediate those issues in schools. In the state of Michigan, so like right our neighbor here in the Midwest, they just passed some historic legislation called Filter First. And Filter First legislation essentially says like right now, we keep testing the water. So whether it's the faucets in the schools, so it could be the water fountains, like the sinks, we keep testing it, but the likelihood that there's going to be lead in there is high. So we already know that. So all of these schools are old, outdated, underinvested. So we're wasting a lot of money testing water when we can already just go ahead and replace the filters, the fixtures, and then test to make sure that the lead is out. So similar efforts, they're trying to do something similar like in Illinois. There are some conversations about it. There's a lot of conversations about like getting the lead out of schools. Like the Chicago Teachers Union has been talking about it for a long time. We have some local activists like organizations like Bridges Puentes, Southeast Side Environmental Task Force. So there is a lot of folks who are like ringing an alarm about this. But in Michigan, they have done some legislation that I think that Illinois could potentially adopt and, you know, and make it, you know, Illinois specific, right? So we don't need to just take what Michigan did, like, let's make it make sense for us. But I think they've really tapped into something that makes sense. It's like, why we keep wasting money testing something we already know the answer about? So like just put the fixtures and fix the fixtures, put the filters in, give kids access to clean and safe drinking water, and then test. So I think that's something to look at. And to answer your other question about the hospitals, so I know that's something that came up with the convening I mentioned about Cook County Commissioner Donna Miller and Rep. Kelly. There's a really cool article from Crane Chicago Business that says it's called Black Maternal Mortality Has Reached a Crisis Level. Here are the Chicagoans taking steps to stem it. So if you look up Crane Chicago Business and just look up Black mortality, you will see two women pop up, and then it really gets into details about exactly what you're talking about hospital access is limited, and how they're trying to, from a philanthropic standpoint, and also leveraging the business community to really think about like investments in communities and how do we build like holistic communities, not just, you know, grocery stores are important, well-functioning schools are important, but also let's think about hospitals and libraries and other stuff too, to really make robust community centers for folks. No problem.
So you gave us a lot of information, which is wonderful information that some of us wouldn't have if you weren't here talking about it. And I see all of everything that you just said as a crisis. Mm-hmm. And so like, I'm just thinking about some of the people that I interact, when I was telling them about today, right? Mm-hmm. They were like, well, what is that? Yep. And so people don't know what Black maternal health water crises is. They don't know that, you know, there are these issues that when you go to the hospital that you're gonna be saturated with all kind of biases that people are gonna have. I mean, I'm experiencing that now. This week we had a crisis, and if it wasn't for my husband and I there advocating, you know, people would just push you to the side and not deal with the issue. Mm-hmm. And you know, I mean, those things anger me, so I'd be ready to, you know, jump all over people. Uh-oh. But my question to you is how do we sound the alarm? So I'm glad you said Mary Flowers, because she's in my district. I live in Ashburn. And so, yes, we're saturated by trains. If you go this way, it's a train track. If you go that way, it's a train track. If you go that way, it's a train. So we can't get out of the area that we live in without crossing a track. Mm-hmm. And so we know that there's a, you know, what you said about, you know, the industrial area there is for sure. So I will be in contact with her. But as a resident, in this area. I've never seen that on any of her flyers. I've never seen that information come through or heard anybody talking about it. And so, you know, I can pretty much get information. Other people can't. If they don't have access to internet, if they don't have access to clean water and they don't have access to all these things, the internet is not an issue and they don't know how to go and look up and resource all this information. How do we sound the alarm for everyday folk so that they can say, oh yeah, this is an issue for me, and possibly, you know, do something about it, because this is a big issue and it's always been a big issue. This is nothing new.
But yeah, I mean, that's a loaded question, right? I think that, you know, people are fed up with government, and rightfully so. I mean, there's some distrust, particularly within the Black community with what the government can do and when they do it. But I think it's important, regardless of, you know, our historic experience with it, like being engaged is better than not being engaged. And I think that neighbor to neighbor, right? So I think it starts, I mean, in addition to like wishing that we had elected officials that were a little bit more active and hosting these community meetings and actually going door to door to talk about these issues. A lot of this stuff happens neighbor to neighbor, right? So do you know the person to the left and right of you? Do you know the person across the street from you? Is this something that you would be comfortable going to them and like, even if you don't know who they are, like knocking on the door and say, hey, like we live, I mean, this is literally what my mom had to do at our new home that's in Ashburn. It's like right off 78th and Central Park. Like we're right off the train track. And so she had to go to everybody on the block. Like, and this was her way of introducing herself and saying, hi, I'm your neighbor. If you're tired of this train, you know, stopping here and just sitting here for 30 minutes and then having the urge to reverse for another 30 minutes and we're sitting here for an hour and now we have to go down to Kedzie to actually get to where we need to go. Like she literally knocked on everyone's door and like talked about it. And they ended up calling the alderman's office. I know the alderman ended up having a community meeting of some sort where he pulled together the state rep, as well as the congresswoman at the time, it was Marie Newman, really talking about from a federal perspective, how to like do better regulations when it comes to like train related ordinances. So it's not necessarily like a quick fix that can like happen overnight. It's something that has to happen on the state and federal level. When it comes to like how frequently trains can come through certain neighborhoods, like can they blow their horn at a certain hour? Like there's so many different things that, you know, from a local, state, and federal level that need to be in alignment. Going back to the earlier question about how these different levels of government should work together. But I do remember, particularly in Ashburn, that was a conversation that was happening last year. I just don't know where it went. But I think, you know, as many people we can get on our blocks to blow up the alderman's phones, or wherever you are in the city, all 50 wards, if this is something, an issue in your community that you think is important to you, getting a petition going, actually getting folks to call in, attend these town hall meetings. I know it's a lot to put on people because people got things to do and there's a lot going on, but all of these different issues, whether it's lead service line replacement, whether it's train traffic, any other things, like folks aren't going to act on it unless the elected officials feel that there's pressure to do something about it. And that's the unfortunate truth about it.
One final question from the chat. And so you had mentioned Michigan had some great sort of, you know, scratching the surface legislation to kind of get the ball rolling on, you know, some of this stuff. But are there any sort of other cities or states that you see as sort of a inspiration in sort of environmental justice work or Black maternal health or just any kind of reproductive justice work along these lines that we can kind of look to sort of see what they're doing and then see how we can kind of improvise for Illinois?
Ooh, that's a good question. From a Black maternal health perspective, I'm not sure. So a lot of what I'm doing is just like really Illinois centric, particularly just, you know, newly co-chair of this task force. That's something that we want to do just legislatively. Like there's one thing to have like, you know, Rep. Mary Flowers and other folks who are on these like Black maternal health task force at the state level. Is one thing to like see what they've already started and like what can we get across the finish line. But that's something else that we want to do with the task force to figure out what other people doing that we can borrow the language, make it look nice and like, let's get this done. So not sure from a Black maternal health perspective, but from a lead pipe perspective, Michigan definitely is someone we look to, but New Jersey as well. So New Jersey had thousands of lead pipes, and mind you, it's a caveat to some of these things because some of these people had to be sued, right? And so sometimes you just got to roll up your sleeve and sue some of these some of these states and say until we get the job done. But regardless of the lawsuit aspect or not, Newark, New Jersey in particular did something really interesting because they had thousands of lead pipes and they were able to get their lead pipes replaced within 2 or 3 years. So they don't have like the amount of lead pipes that Chicago has by any means. Like Chicago has more than any other city in the US. So I'm not trying to compare it. It's like apple to oranges in some type of way. But at the same time, they made it a priority. So they said, we're going to have the political will to do this and we're going to do it right and we're going to do it quickly. We're going to employ a workforce to help get this done. So yes, it's one thing to have labor unions, but we also have young people. We have the previously incarcerated. We have women. We have folks from low-income communities that are unemployed. How do we train them to be skilled laborers to learn how to take these lead pipes out, replace them, and let's move on to the next house. They also did it on a block by block basis. So what's issue in Chicago right now, we kind of like bounce around. So like one house at the end of the block is eligible for lead service line replacement. These in the middle aren't, so we're gonna go down the street. So it's like this kind of like hopscotching approach. Newark said, we're gonna knock on everybody's door. We're gonna be organizers. We're gonna talk to the residents. We're gonna be like, hey, you have a lead service line, we need to replace it. You don't need permission from the landlord to replace your lead service line. As a resident, as someone who's in this house using this water, you should be able to give me permission to replace your lead service line. And so on a community engagement level, block by block, door by door, say, hey, we want to replace the lead service line. They got the buy-in and they were able to replace block by block. The other thing that was interesting about Newark is that, as I mentioned earlier, like the federal government money is limited, right? So we had a historic investment of water infrastructure funding, but it only scratches the surface of like the money that's needed for Illinois to replace all of its lead pipes. And so Newark, New Jersey said the water utility should pay for lead service line replacement. We didn't put the lead pipes in, you did. So why should we pay as taxpayers to replace something that we didn't do? And so, like I said, it's a controversial thing because, as you know, you put responsibility on other people to do stuff, it's going to cause some headaches. But in Newark, they were able to put in the city ordinance saying residents can get permission to replace lead service lines. The water utility is going to fund the replacement, and we're going to create a workforce development program that works alongside labor unions to speed this up. And those are 3 things that they did at the city level that the state of New Jersey adopted as a state legislation to say the rest of the state can follow suit if they choose. We have a long way to go to match that in Illinois. But like I said, I think the Johnson administration has only been here for 5 months now, maybe 5 or 6 months. I don't even know what time it is anymore. But they're also looking at what Newark has done and looking to, figure out, does this make sense in Illinois? And we'll see. Okay. Step to the side.
Well, thank you so much to Chakena Perry for this incredible conversation. I am personally a new mom. I have a 6-month-old at home with my husband right now, but I, between tears of just, knowing what women go through to be, in motherhood, to sort of anger and frustration, and also really a lot of hope. I think one of the most beautiful things about sort of sitting here listening to Chakena talk is there are so many things that we can all get involved with. And I think that it is not a very comfortable conversation, things around women's health. It seems to be, not always comfortable. But we have to have these conversations. We have to have these conversations, organization to organization that work in these spaces. We have to have these conversations with our neighbors and our city, our elected officials, and our country, and really, address the crisis that this sort of thing has really become. And I think that there is incredible action items that, please personally sign me up to be a part of, because I want the kind of world that's, safe for my baby and safe for all babies and all women and all people. And this is really a humanitarian thing that we're talking about tonight. So I appreciate everyone sort of joining in. And I will, be using, our league stuff to get more information out about this issue. So, thank you to everyone participating. Thank you to everyone taking time to talk about these issues. I really appreciate it. And I put some links in the chat to information about where you can get more information on this stuff. And thank you all for a good night.